Okay, my name's Charity and I'm going to be doing a chest tube dressing change. So I have already looked at the physician's orders and it says that I'm doing a dressing change now for a chest tube. So I'm looking at the patient's name and date of birth and just making sure that the physician's order sheet is filled out correctly, which it is. And I've already done the chest tube drainage system safety checks. So emergency equipment is in the room. The suction is working or set to the correct suction. The tubing's not kinked, there's no holes, and the drainage box is, everything is set correctly. So it's at 20 millimeters of mercury, there's titling, looking at the drainage, and just making sure that the orange ball is within sight, which it is. So everything is good. And it's below the patient's site. So everything is draining fine. So we're just going to get our supplies, enter the room, wash my hands. So hello, my name's Charity. I'm going to be your student nurse today. So just do a management safety check, call bells within reach, patient's not in any distress, the bed is at the lowest position. So I'm just going to look at your wristband. So patient's name, date of birth, and no allergy band. So can I have your name and date of birth? And do you have any allergies? Okay, so I've confirmed it's the right patient. So I'm here to do your chest tube dressing change like we spoke about before. Is this a good time? Yes. Okay, so I'm just going to be removing the old dressing, just assessing the site and the drainage, and then I'm going to be cleaning it and applying a new dressing. So do you have any questions? No? Okay, and do you consent to having this procedure? Yes? Okay, perfect. So I'm going to put the patient in a semi-Fowler's position with their arm above their head. The bed is at waist height, and also the table will be at waist height, and I will clean my area before setting up. So I'm just going to set up my sterile field here. So I will just wash my hands, and I have a garbage down on the floor there, and then I'm just going to use this as a garbage as well. I asked the patient if that's okay, and he stated yes. So I'm just going to open my field. Okay, so we don't need this. So I'm just going to throw this out. And also I would have placed a blue pad underneath the tubing there just to make sure that the bed doesn't get wet. So we're just gonna move these here for now. Okay, and then we already have a garbage, so we're just gonna throw this garbage out. And then I'm just going to be moving all of this out because we're going to put our Jelonet in there. Okay, perfect. Okay, so we're just going to start adding things to our tray. So here we will add some more 4x4. So I'm just going to be opening it away from my sterile field and adding them in here, and then I'll throw that out. And I'll just add some more. Throw that out, and then we'll just add one more. Okay, and then I'm going to add my drainage sponge, so also opening it away from my field, and then I'm going to be adding 2 of the drainage sponges. And throw that out, and then we're going to add the Jelonet, so also opening it away from my sterile field. Okay, and we'll just set that in here, and then we'll just throw that out. And then we're just going to be adding the normal saline. So just making sure to stay away from the field there and adding it. Okay. So now that everything is set up, I'm going to wash my hands, and I'll put on gloves. And we're going to remove the dressing. So I'm just going to be palpating here for subcutaneous emphysema, so I don't feel anything that feels like Rice Krispies, so that's good. So now we're just going to make sure we're stabilizing the chest tube while we are taking off the tape. So we'll just kind of peel at the edges. Making sure to always stabilize the chest tube. And then we're just going to remove the dressings. So just assessing to see if there's any drainage, and there isn't, so that's good. So we will just take this off, take our gloves off, and throw that out. And then I'm going to wash my hands, and then I'm going to remove the Jelonet here. So removing this, just looking for any drainage. There's no drainage on that as well, so then I will just throw that out. So I'm just going to assess the site here. So the incision site looks good. There's no redness, swelling, or drainage. There's no odor. And so the peri-wound skin also is intact. There's no redness or swelling. Also the tube looks intact. There's no holes or air leaks. So everything looks good. So we will start cleaning. So I'm just going to wash my hands, and then I'm going to put on my sterile gloves. Just gonna move this. So I would actually wash my hands again just to make sure that they're nice and clean because I touched the tape. And I'll open this and we'll throw this out. So now that we're sterile, we are going to start cleaning. So just going to make a rosette. Dip it in the water. And then we're going to clean from the incision site in a circular motion in one swipe. And then I'm going to throw it out. And then we're going to do that again, making a rosette. Getting it wet. And then just moving out a little bit and doing one swipe. And then throwing that out. And then we'll do one more just because it is quite a large area, so we would just want to make sure that it is all clean. So get that wet, dab it a little bit, and then move out just a little bit more. Do one swipe in a circular motion, and then throw that out. And then we're going to clean the tubing. So we're going to make a rosette. Get it a little wet, and then clean the top of the tubing just with one swipe, moving out, and then throwing that out. And then we'll just do one more on the bottom. Okay, so getting that wet. And then we'll just do on the bottom here, so cleaning with one swipe, and then throwing that out. And then we're going to dry it. So we will do the same thing. So we're just going to be starting from the incision site, moving in a circular motion all the way out. Okay. Okay, and then we'll move a little bit more out in a circular motion. One swipe, and then one more. Okay, so in a circular motion, one swipe, and then we'll just dry the tubing. So we'll just use our 2x2s here. Okay, so we'll just dry the top, throw that out, and then we'll dry the bottom. Okay, so we'll just dry the bottom, one swipe, throw that out. Okay, so now we're just gonna add our Jelonet. So we're gonna throw this out. Okay, so we'll just twist this and making sure just to touch the areas that we have cleaned. So we're just going to make sure that this is nice and snug on the incision site because we don't want any air entering because that can cause a pneumothorax. And it's okay if we touch the site a little bit as we have cleaned it. So we are still considered sterile. So now that that is good, we are going to add our drainage sponges. So in two separate directions. So we'll do this one and then we'll go this way. And then we're going to add our 4x4. Okay, so now I'm gonna take off my gloves. I'm going to wash my hands. And I'm going to be putting on the tape. So I have my tape here, the mefix, sorry. And also I have written on here the date, time, and my initials so that the next nurse knows when it was last changed and by who. So let's throw this out. Okay, throw that out, and then just making sure that every part of it is pushed down, and then we'll grab our next piece. Okay, and then we will put it here, and then on this side we're going to tent it. So we tent it so that if the patient does happen to pull on the tubing, that it's not going to pull at the site, it will just pull at the tape. So we're going to tent it here, making sure that it is touching at the bottom, and also just making sure that the tape is secured underneath as well so that there is no chance of air getting in. So right here it's tented around the 4x4 and the drainage sponges. It is all pushed down so there is no chance of air getting in. Okay, so now that we've done that, I'm going to wash my hands again, ask the patient if they're doing okay. They said everything's fine, so that's good. I'll clean up all my supplies, I'll put the bed down, make sure the call bell's within reach, the patient's not in any distress, they don't need anything else. So then I'm going to leave and I'm going to document that I did the dressing change. So I was ordered to do the dressing change. There was no drainage noted. The incision site there was no redness or swelling. There was no subcutaneous emphysema. And the peri-wound skin was intact, no redness or swelling there. The tubing was intact.